Client Assessment Procedure. This content outlines the process of performing a thorough health assessment in a clinical setting. The goal is to gather essential information to assess a patient's health status and ensure proper care. Below, we will explore the steps in the assessment, providing rationale and clinical correlations to support each part of the process. I. Environment setting. The environment in which the health assessment is conducted plays a significant role in creating a trusting and comfortable atmosphere for the client. A comfortable environment helps ensure accurate information is shared and the client feels safe. A. Establish a relationship and explain the procedure. Rationale. Building rapport with the client is essential for obtaining honest and accurate information. Explaining the procedure helps set expectations and reduces anxiety. Clinical correlation. When clients understand the procedure and feel at ease, they are more likely to provide detailed answers and engage in the assessment. B. In privacy and make the client comfortable. Rationale. Privacy and comfort directly affect the client's emotional well-being and willingness to share personal information. A controlled environment with proper temperature, lighting, and limited distractions reduces stress and fosters trust. It is especially important when assessing sensitive issues like domestic violence or mental health concerns. Sit down for the interview. Rationale. Sitting down at eye level creates a more equal interaction between the healthcare provider and the client, helping reduce power imbalances. Clinical correlation. Nonverbal cues like body language significantly influence communication. Maintaining appropriate social distance and eye contact enhances client comfort and openness. D. Use therapeutic communication techniques. Rationale. Open-ended questions and therapeutic communication techniques allow the client to express themselves freely, leading to a more accurate and complete assessment. Clinical correlation. This allows healthcare providers to gather comprehensive information, understand the client's concerns, and prioritize issues effectively. E. Consider religious and cultural characteristics. Rationale. Understanding cultural and religious backgrounds helps avoid misunderstandings and ensures respect for the client's values and beliefs. Clinical correlation. Certain health practices, such as dietary restrictions or preferences regarding touch, may influence the approach to treatment and care. F. Keep note-taking to a minimum. Rationale. Excessive note-taking may distract from the interaction, making the client feel they are not the focus of the conversation. Clinical correlation. Maintaining eye contact and giving the client full attention fosters trust, which is essential for gathering personal and sensitive information. G. Types of health and physical assessments. Rationale. Health and physical assessments provide a structured approach to gather data on various aspects of the client's health. Clinical correlation. Accurate assessments are the foundation for developing an individualized care plan and ensuring appropriate interventions. The health history provides a comprehensive overview of the client's past and current health status, offering insight into potential concerns or risks. A. General state of health. Rationale. A person's physical features, posture, and level of consciousness give immediate insight into their overall health status. Clinical correlation, for instance, changes in posture or consciousness levels may indicate neurological or psychological issues. B. Chief complaint and history of present illness. Rationale, documenting the client's primary concern, chief complaint, and related symptoms is essential for understanding the underlying issue. Clinical correlation. This provides direction for the physical examination and helps prioritize diagnostic testing. C. Family history. Rationale. Family health history identifies hereditary risks and provides context for understanding the client's condition. Clinical correlation. Knowing about conditions like heart disease, diabetes, or cancer can lead to early interventions and preventive measures. D. Social history. 1. Rationale. Lifestyle factors such as diet, exercise, alcohol, drug use, sexual practices, and occupational hazards directly affect health outcomes. 2. A clinical correlation. Sexual practices or travel history may expose them to unique risks that impact their health. E. Domestic violence screening. Rationale. Identifying domestic violence early can be critical for the safety and well being of the client. Clinical correlation. Conducting this assessment during the health history interview ensures privacy, allowing the client to disclose sensitive information without fear of judgment or retaliation. Mental status exam. The mental status exam assesses the client's cognitive and emotional functioning. It is an essential component of the health assessment, particularly when psychological or neurological issues are suspected. A. Appearance. Rationale. Observing the client's appearance, including posture, grooming, and hygiene, provides clues about their mental and physical health. Clinical correlation. Poor hygiene and unkempt appearance may suggest conditions like depression or cognitive disorders. B. Behavior. 1. Level of consciousness. It is critical to assess the client's level of alertness and awareness to ensure that the assessment is performed appropriately. Clinical correlation. A decreased level of consciousness may indicate a neurological issue, intoxication, or a metabolic disorder. 2. Facial expression and body language. These nonverbal cues offer insight into the client's emotional state. Clinical correlation. Discrepancies between facial expressions and the context of the situation may indicate mood disorders, such as depression or anxiety. Speech. Speech patterns can reveal cognitive impairments or mental health conditions. Clinical correlation. Slurred or incoherent speech may indicate a neurological or psychiatric issue, such as a stroke or psychosis. See cognitive level of functioning. Rationale. This assesses the client's orientation, memory, attention span, and ability to learn new information. Clinical correlation. Changes in cognitive function could signal the early stages of dementia or other cognitive disorders. IV. Physical exam. The physical examination is a systematic process that uses a combination of observational and tactile skills to gather objective data about the client's health status. A. Overview. Rationale. A well-prepared environment with the right equipment ensures a smooth, effective examination. Clinical correlation. Using proper techniques, e.g., correct lighting, exposure, and tools, minimizes errors in assessment and improves diagnostic accuracy. B. Assessment techniques. 1. Inspection. Rationale. Visual inspection helps detect abnormalities in the body's appearance. Clinical correlation. For example, skin rashes, pallor, or swelling may indicate systemic conditions such as allergies or infection. 2. Palpation. Rationale. Palpation allows for the tactile assessment of abnormalities in texture, temperature, or tenderness. Clinical correlation. Tenderness in the abdomen may suggest an underlying issue like appendicitis or peritonitis. 3. Percussion. Rationale. Percussion helps assess organ size, position, and the presence of air, fluid, or masses beneath the skin. Clinical correlation. Dullness over the lungs may suggest pleural effusion, while hyperresonance may indicate emphysema. 4. Auscultation. Rationale. Listening to body sounds, e.g., heart, lung, bowel sounds, can provide critical information about the client's health. Abnormal heart sounds, such as murmurs, can point to heart disease, while irregular lung sounds may indicate respiratory conditions like pneumonia. Vital signs. Vital signs provide immediate, crucial data regarding a client's cardiovascular and respiratory status. Clinical correlation. Abnormal readings, e.g., elevated blood pressure or low oxygen levels, may indicate underlying health issues that need immediate attention. Conclusion. A comprehensive health assessment is a cornerstone of clinical practice. It includes understanding the client's environment, obtaining a detailed health history, conducting a mental status exam, and performing a physical examination. This structured approach ensures that healthcare providers collect relevant data to diagnose and manage health conditions effectively, ultimately leading to improved patient care outcomes. Each step of the assessment has a direct correlation to clinical decision-making, aiding in accurate diagnoses, appropriate interventions, and monitoring of patient progress.